I would submit to you that every single one of those steps was A, complete and utter bullshit, and B, premeditated.
Before we begin, I'd just like to thank the new paid supporters to the show. On Spotify, I'd like to thank Annalise, Lindsay, Jonathan, and Aaron. Welcome on board. And over on Substack, I'd also like to thank Sophie. I'd like to thank Lucia Williams. And I'd really like to thank Keir Kirby. Keir Kirby is the lady who sang the song Groove is in the Heart. She left a message, Doc Malik, to hear voices of truth sharing ideas is surely one of the best examples you could set to uplift, inspire and motivate us. Thank you. I think of you and smile. Groove is in your heart. Keir Kirby from D Line. Wow, that's a lovely message to receive. And lastly, I'd like to thank Wendy Webb. Thanks for all of you who've subscribed. I'm sorry if I've missed any names. I know times are tough and, everything adds up. Inflation is rampant and it's not easy. There's so many people to support out there. So those of you who've stuck with me from the beginning and, believe in this show and believe in what I'm doing, I'd just like to say thank you very much. All right, folks, enjoy the show. Folks, around 2 years ago, I did a podcast with someone called Nick Hudson. And in that podcast, he sat opposite me in the studio. He demolished the timeline for COVID. This 28-day timeline where, this pandemic was announced. Just check out this video and please share it with everyone that you know. Because even now, 6 years on, there's people who believe in the pandemic narrative. And as Nick Hudson breaks down, it was all bullshit. I ask anyone to watch this video clip and tell me it's not the case. I mean, if they're still insisting that the government and the WHO narrative is correct, then they're just gone. There's nothing that we can do to save these people. But just check out this video.
The first thing that happens is we have a very strange phenomenon in China. An eye doctor spots a case of supposedly atypical pneumonia. Now, that event is a very strange event to start with. There's lots of pneumonia all the time in China, okay. But he says, this one's very strange. So that's 30th of December. And then supposedly we have the emergence of, according to the World Health Organization already, on January the 5th, they're telling us that they have identified 44 cases out of a population of 8 million people of atypical pneumonia of unknown cause. So that's taken them 5 days from the time that the first doctor said he'd seen something strange. Then 2 days later, they had declared that a new SARS-like virus was the cause of these pneumonia cases. 2 days after they'd decided that they'd identified 65 unusual cases. Just 3 days later, we have a situation where the firm manufacturing the first PCR kits to test for this thing is already shipping them. So let's just recap. We've gone from the identification of the first patient to the shipping of the first kits in 11 days. On the same day when they shipped the kits, the first gene sequence is published. 2 days after that, the World Health Organization has already accepted Christian Drosten's PCR protocol as what they call the gold standard for testing for this new disease. And a few more gene sequences are published in that time. 9 days after that, the famous Corman-Drosten protocol is published, is submitted for review, and 27 hours later, it's peer-reviewed and published in a journal that Drosten is an editor of. 2 days after that, there's a Chinese study about the specific clinical symptoms that supposedly relate to COVID, and that's published in the New England Journal of Medicine. We're still only 25 days from the beginning of this whole thing. And then 5 days after that, the first study is published also in the NEJM about asymptomatic transmission. We've established in a compressed time frame of just 26 days, there's a new clinical manifestation. It's caused by this virus. This virus has the following sequence. Here's a test, which is the gold standard in identifying that sequence, and the research identifying the primers that we're going to use all over the world has been submitted for peer review and published, and we've described the clinical features of this so-called new disease. I would submit to you that every single one of those steps was A, complete and utter bullshit, and B, premeditated.
I, Ahmed Malik, am a private civilian protected by the Geneva Convention. My Substack, social media posts, and podcasts are my personal experiences, observations, and opinions. This information is for educational purposes only. Although I am a doctor, I am not your doctor, and I am not providing medical or legal advice to you or to the wider public. I am not licensed or registered with the GMC or any other licensing board. The responsibility for the interpretation, due diligence, and use of the information from my Substack and my podcast lies with you, the viewer and or listener. Please do your research and use your discernment. It is not my intention to harass, intimidate, offend, defame, conspire, blackmail, coerce, or cause anxiety, alarm, or distress to any man or woman, and the information presented here is done so with peaceful and honourable intentions. Enjoy, folks.